Hello. Good evening, fellow friends and loved ones. Yes, it's once again a very great honor and great privilege to come to your homes this evening. Yes, um, it's very cold evening. Yes, today is the 14th of June, um, 2021, and God has been gracious unto us and has given us this wonderful day. I guess we all had a wonderful morning and afternoon, and then we are having a wonderful evening. Thank you very much for your time and the opportunity to come to your homes to discuss another very important health condition again. Yes, last week was very awesome. We had a wonderful time. We talked about a condition called POTS disease. POTS disease, POTT, and then apostrophe S disease. And then we also noted that Ford disease was also called spinal tuberculosis. We had an awesome discussion. If you want to have a recap of this condition, you can just log into our Facebook or you can go to YouTube. Yes, just type Ford disease and then you have the discussion there. And so we're beginning today's discussion in the name of the Father and of the Son and the Holy Spirit. And thank you very much once again for the opportunity. So today we're talking about a condition called avascular necrosis. Avascular necrosis, or some people mention as osteonecrosis. Yes, osteonecrosis. And actually it's a condition that affects the joints in the body. Yes, mainly it affects the hip joint, but then it can affect the shoulder joints, the wrist, it can affect the ankles. Yes, it could affect some joints in the body where movement is actually more pervasive or more frequent, such as walking. So when you are walking, you walk more. There is no human being who doesn't walk. Most human beings walk a lot, especially when you are at your prime, from 30 to 50 years. And then this age range I've mentioned actually tells us the number of people who are affected. Per research has shown that people who are between 30 and 50 years are predisposed to this condition called avascular necrosis because they are prone to so many incidents or accidents. Yes, and they are likely to have this condition called avascular necrosis or osteonecrosis. So now we begin the condition. So first of all, what is avascular and what is necrosis? Yes, avascular is a big word, but then we can break that one down to avascular. A and vascular. Vascular, when you talk about vascular, it means where there is our vessels, the blood vessels, where the blood flows to the body. So vascular, actually, it's a scientific word. It could mean also something that is porous, something can go through. So vascular, we have blood vessels. We have I'm sure you heard veins before. Veins is actually a name that is used for all kinds of body. Some people, when they're talking about nerves, they say my veins. When they're talking about their blood, their arteries, they say their veins. But veins are actually separated from other vessels. You have veins, you have arteries, you have nerves, and so these vascular vessels, such as the arteries and the veins, allow blood to flow to the body. And so when we say A in this scientific term, in this context, means not or absent. So when we join the two together, avascular, it means there is less ability of the vessels to allow blood to flow due to so many instances, such as it could be trauma, it could be, which we'll be talking about very soon. With trauma, it could be aging and other factors. And so avascular means the place that the blood passes, that is the space the blood passes through, that's the vessels, the veins and arteries, are unable to allow the blood to flow due to so many instances, and we're talking about them. And then when we say necrosis means the wearing away or destruction of a tissue. So a tissue is actually a group of cells coming together. So if you look at my hand here, it comprises a bone and then muscles nerves and arteries and veins. But my bone actually has so many cells coming together to form a tissue, and the tissue is called the bone tissue. So bone is actually seen as a tissue when the cells come together. So when my bones begin to reduce in size, we call it degeneration. But in a case where blood, we mentioned the avascular. Avascular means blood not going to a particular part of the body. So when this blood doesn't go to a particular part of my body, it can cause the bones to reduce in size, and the reduction in size is called degeneration. But then the ability of the blood to go to that side to cause the bone to retain its function could result in necrosis. Necrosis actually wearing away or reduction in the integrity of a tissue. That is what we're talking about now, a bone tissue. And so many instances can cause necrosis to occur or avascular necrosis to occur, which you'll be seeing some pictures very soon. I have a lot of pictures to show us, and I'm sure we'll appreciate it a lot. Okay, so we are talking about, so those who just joined, we're talking about avascular necrosis or osteonecrosis. Yes, and so it affects so many joints in the body, but specifically the hip, the ankle, the shoulder joints, but mainly the hip joints. Okay, so let me just give us a quick definition for this condition, avascular necrosis. Actually, it's a death of a bone tissue. We've talked about the bone tissue, and then death of bone tissue due to lack of blood supply to that part of the bone. Okay, so it could lead to distraction of the bone, it could lead to pain, it could lead to actually dysfunction of your normal body structure. So if it's your hip and your hip doesn't have enough blood supply, you could have pain, which could affect your walking. It could also affect your work, because if you have pain, then you can't go to work. You always be in bed, and then you'll be kept in bed. So this actually might look unserious, but then if you are a worker and you are a very active person, you could lose enough, you could lose a lot of money, you could lose a lot of revenue. If you generate money, if you're a market woman, yes, you could lose a lot of revenue, because then the bones will be in your body will not have enough strength to be able to work well, or even walk well. Yes. Okay, so actually there are so many causes of this condition. It could be as a result of taking in steroids. Actually, steroid medications actually helps also to boost our system. And so if you look at our athletes, those who run 1,000 meters and those who run 100-meter race, they take in steroids to boost their immune system. And other people also take it for other reasons. But then it is shown that if you take in too much of these things, it could also affect your bones, and it could pull the calcium content in your bone, and they could result in this condition having come early. And then other conditions such as also sickle cell. So I'm sure you've heard about sickle cell before, because now they are really coming up and then they're advocating on it. So sickle cell actually is a blood, it's a gene factor where your body is not able to have enough of the ability to clot very, very well. And so people who are sickle cell, when they have this, when immediately they are hurt, it takes a long time for the wound to heal. And so just imagine you falling down and your hip has dislocated, or your hip has been injured. You have difficulty in terms of healing, and when this doesn't heal well, when your hip injury doesn't heal well, and the blood vessels also doesn't heal well, or doesn't allow the blood to flow as normal as possible, then you could have this condition called avascular necrosis. And it's shown that most people with this condition, or this status called sickle cell, are likely to have this condition called avascular necrosis. That is what research has said. And yes, and so which people are predisposed to this condition called avascular necrosis or osteonecrosis? Yes, so we say that anyone can be affected. There is no it's not respecter of persons. But then I mentioned in an earlier statement that the most active people are likely to be affected, and so those within the ages of 30 and 50 years are likely to be affected with this condition called osteonecrosis or avascular necrosis. That is what research has said. So then, what are the signs and symptoms of this condition called osteonecrosis or avascular necrosis? Okay, so before I continue on, I'm sure you will hear me saying osteonecrosis, but what is osteonecrosis? Osteo means bone, and necrosis, as we said earlier on, is actually a distraction of a particular body structure or tissue. So a bone is also a tissue. So when you have distraction of the bone, you could have necrosis of the bone, which means osteonecrosis. And so some of the symptoms of this condition called osteonecrosis actually is, one main symptom is pain. So the patient or the person complains of pain in the hip joint, the ankle joint, the shoulder joints, but mostly the hip joint, because that's where activity takes place mostly. So we walk a lot, and so science have shown that yes, we are likely to have this condition called osteonecrosis at the hip joint at most at times, and the patient or the person will complain of pain during the night, because at night that's when there is less activity, and so there's less activity, the bones or the hip joint is predisposed to abnormal turning, and there could be the exhibition of the necrosis at an active rate, and so the person complains of pain around the hip as intense as possible in the evening or in the night. So we'll say, what are the prognosis? When we say prognosis, what are the chances of you not having this condition called avascular necrosis? Okay, and so it all boils down to you're also taking care of yourself, and then eating well to get your bones strong enough, and exercising well. I think we'll be deliberating or delving into it more in the later time during this presentation. But then we will say that half of these people with this condition are they require surgery. Yes, they require surgery to have this condition being treated. They require surgery, and so we take note and refer to patients with this condition called avascular necrosis as early as possible, and refer them to the medical doctor when we realize that with exercise and with medication it doesn't come on very well. So the pain actually experienced by this person with avascular necrosis is actually relative. It could be mild, it could be moderate, it could be severe due to the level of intensity of the pain. And so it's appropriate, or most appropriate, that when you notice that you have pain in your hip joint especially, you report as early as possible. So the necessary tests that are required to be carried out are carried out as early as possible, so that we can manage the condition. And there are modifications also, which we'll be talking about very soon. And so this condition actually progressively occurs. It occurs gradually. It doesn't come as once in a it doesn't come out of the blue. It takes time. So the pain shows itself as on and off pain in your hip, and then gradually it becomes intense. So as we mentioned earlier on, today's topic is mainly reduction in the hip joint. So it's mean talking about osteonecrosis or avascular necrosis of the hip. So we delve in more about the hip, and so we have pain in the hip. We also have discomfort in the hip, and so the patient complains of pain in the hip. It could be around the groin. The groin is actually just beside your genital organ. So we just beside and just a little bit above your, on the left or on the right part of the genital organ, a little bit on top of it. And so we have the groin there. And so if you have pain around that side, you're likely to have this condition called osteonecrosis. And if you have pain around the buttocks region, there are signs or symptoms of you having this condition. But mainly the pain is exactly around the hip region. And so we have the hip region, and we should be showing you very soon of a picture of your hip I'm sure we're able to appreciate this very, very well. And so we mentioned earlier on that this condition affects mainly the hip, but other joints also could be the shoulder, the knee, the hand, the foot, that's inclusive of the ankle. This condition could affect just one joint, that's the one hip joint, but then if care is not taken or the necessary precautions are not taken, and it could go to the other hip joints, because the other hip joint might be compensating for the pain on the affected joint. So what are the causes of avascular necrosis? So what causes it? It's actually caused by, scientifically it said that it's caused by an interruption to the particular part of the body, and due to one, dislocation. So when we say dislocation, is actually a bone being taken off the joint. So when you have your leg bone or your thigh bone coming out of the joint where it's supposed to be placed, specifically the hip joint, you could refer to as dislocation. It could also affect your shoulder when your shoulder comes out of the joint totally. So a dislocation is actually when you put your finger around your shoulder joint, and the space that you see there, it's two bones of the finger. So you can see my finger here. This is one bone. Scientists, or we say that is called a phalange. Yes, phalange. So we could have the proximal phalanx, the middle phalanx. This is the proximal phalanx, this is the middle phalanx, and this is the distal phalanx. So the distal phalanx and the middle phalanx, this distance here, when you put your finger in your shoulder, and then it's this distance, that is the two finger here, it means a dislocation. If it's just one, that is just here, it means it could be a subluxation. It means the shoulder hasn't come out fully from the joint. It could be a subluxation, as we say in the scientific term. Okay, so dislocation can also cause avascular necrosis. That is where we have shortage of blood supply to a particular point or a particular joint. And so also you could have excess deposition of fat in the blood vessels. So when you say, this is actually a big sentence, but when you have too much fat in your blood vessels, if you eat a lot of fatty foods like chicken, if you eat a lot of fried rice, I'm sure I'm hitting some hard points. But then it's advised that we don't eat a lot of fatty foods. Even if we eat, we involve ourselves in active exercises to break the fat down, and this is assured to prevent this condition called osteonecrosis from occurring. As we mentioned earlier on, some disease such as sickle cell anemia could cause this condition called avascular necrosis. There's a condition also called Gaucher's disease, where it's caused by reduced blood supply, and this also can cause avascular necrosis. So what are the risk factors of this condition? What, when we do, could draw us to having this condition called avascular necrosis or also necrosis of the hip? So we could have trauma. So when probably you fall down in the bathhouse, you fall down by or near the gutter, you fall down when someone pushes you or someone blows your hip or a car hits your hip region, you could have dislocation of your hip, and then this could be an indication of you having or likely to have osteonecrosis of the hip, or you having osteonecrosis of the hip. Yes, as we mentioned earlier on, also steroid use, those athletes also who take a lot of steroids to boost their immune system could have osteonecrosis of the hip when they do it too much. Okay, so as we mentioned earlier on, also research has shown that those who eat a lot of fatty acid foods could have osteonecrosis, because these fats are quite big structures, and they tend to block the blood flow in the vessels, and these will cause loss of blood supply to the particular joints, especially the hip. And so we advise that we minimize our fatty intakes, such as chicken, pork, and other fatty foods. Yes, and so we should minimize them. And also excessive intake of alcohol. So those who take a lot of alcohol, we advise that you stop, because the alcohol is likely to pull your calcium content, and it's likely to reduce the calcium content and could cause necrosis of the hip. And then specifically to this condition, it could reduce or shrink the blood vessels, and then reduce the ability to supply blood to the particular joints, especially the hip. And this is also a caution to all those who drink alcohol to minimize or to stop. I would say to stop drinking alcohol, yes, because it's not good. It's not good. And also radiation therapy. Those who go to those who have cancer, and so they are likely to have this condition called osteonecrosis, because then with this rays, this radiation, it causes the vessels to narrow, and then could result in loss of blood supply to these joints, especially the hip, and cause osteonecrosis of the hip. Also, it's shown by research that other conditions such as kidney transplant, diabetes, HIV/AIDS, yes, because our immune system would have been compromised. The patient's immune system would have been compromised, and this could cause the blood vessels to be injured. And then, in terms of repair of the blood vessels when they are injured, is almost impossible and could cause loss of blood supply to these joints, and then finally could result in osteonecrosis of the hip. We have other conditions such as systemic lupus erythematosus and erythematosus, and also we could have, as you mentioned, sickle cell. So what are the complications for having this condition called osteonecrosis? Complications means other conditions that could lead or that can be caused by having this condition called osteonecrosis or avascular necrosis. So one could have a bone collapse, you could have the bone destruction totally, and then you could require surgery, which you could have an artificial hip to be placed in, which will be safer and better if done. It could also have loss of the smoothness of the bone will be rough, and there could be intense pain. And there could also be a condition called arthritis. I'm sure we talked about osteoarthritis in our earlier presentations. And so we could have severe arthritis, which could cause intense pain and reduce inactivity or function. So we've mentioned so many things, and so now we talk about the diagnosis. So how do we diagnose this condition called osteonecrosis or avascular necrosis? So we have imaging tests. So the radiographer takes x-ray of your bone and see whether there has been reduction in size. So appropriately we can take both hips and then we can compare. But sometimes it's some medical practitioners also require this one, and the experts could see whether the reduction. But then if you take both hips, it gives you a fair idea of what exactly is going on. And so we take an x-ray by the radiographer, and then we assess. You can take also an MRI, a CT scan, a bone scan, and these also are very good tests when taken, and they give us more detailed structures, and then we can appreciate the level of destruction of tissues more appropriately. And so these are some of the imaging tests that we do, and these give us a very clear indication whether there is an osteonecrosis or an avascular necrosis which has occurred. So then, what are the treatments to this condition? Actually, this treatment is we say that early reporting of this condition gives us a very good prognosis. That is where we have a good chance of having this condition treated to the best of ability, and then the patient returning to function. So at an early stage, the medical practitioner gives medications, that's pain medications or inflammatory medications. Inflammatory medications actually is if there's a swelling, medical practitioners also give medications to reduce the pain. We could have paracetamol, we could have ibuprofen, we could have naproxen, and other medications that are given to reduce the pain. And we have also osteoporotic drugs, which are drugs to prevent the wearing away of the tissues. Also we have blood thinners. So in the case where there's poor blood circulation, there could be clots, that is small structures formed, which when they travel across the body system, they could enter into the heart or the lungs, and which will cause death. And so these medications such as warfarin help to dissolve these small clots or small rounded structures which could cause death from occurring. And so it's also advisable that when this presentation of pain around the hip or the shoulder joints occurs, we reduce activity. That is, we ensure that there's enough rest for the patient, and also reduce activity, and then also engage in a specific activity for the particular joint affected. So if the hip joint, the physiotherapist also is called upon and engage in the treatment to be able to reduce the pain also and then improve upon function. So aside that, the physiotherapist also engages in exercises which will be shown very soon, some various exercises that we engage in to minimize the pain and return to function. Also we have electrical stimulation where some signals are sent into the hip to reduce the pain. Also we have cord compression, and these are all surgical terms where in the case where there is very little to do, the patient is then taken to surgery, and then the necessary is done to reduce pain and so return to function. We have also bone shaping, we have joint replacements, and then we have joint replacement is the particular points affected, the particular joints affected. If it's the hip, we have hip replacement. If it's the shoulder replacement. And these are artificial structures that are placed to replace the natural one that has been compromised. Also, we also have the regenerative medicine treatment where we have bone marrow aspiration, and there are so many surgical treatments for this condition. And so one may ask, are there any preventive measures? Yes, there are. So far as there are causes, there are solutions, or there are preventive measures. And so subsequently, if patients are affected, we give cautions to those who are not affected, and then I'm sure you are part of these. And so we advise patients, and then which is a must, to limit alcohol intake or stop taking alcohol as best as possible. And the latter advice is needed to be taken than the former. And also we should also keep cholesterol levels normal. And so if possible, you can visit the pharmacist nearby or the hospital nearby to check your cholesterol level as constant as possible, so that we know that we are in check and making sure that you are not likely to have this condition called osteonecrosis at an earlier age, which is stated earlier on as between 30 and 50 years. And also avoid smoking. So smoking also is likely to destroy these blood vessels and also cause necrosis. And at the hip, it could cause osteonecrosis at the hip joint, and the bones can reduce in size, could cause pain, could cause so many complications we've talked about in our earlier moments in this presentation. And also we also monitor our steroid use. So our athletes who are engaging in activity, we plead with you to monitor your steroid use, and those also who are engaged in other high impact exercises or high impact occupations, and we should monitor your steroid use, or you can see your medical doctor to be able to regulate your steroid intake. Okay, so we talked about the condition, the causes, the symptoms, the diagnosis, the preventive measures, and then the treatment. And then to be more specific, what are the prognosis of this condition? So it is noted that for pain or certain mishappenings around the hip joint or the shoulder joint or the hand or the foot, if you experience the symptoms for less than 3 years, surgery is not required, will not be required. But if the pain persists for more than 3 years, then surgery is required. But it's shown that half of the people who have this condition for less than 3 years require surgery, because the more the degeneration or the necrosis occurs, the more painful it is, and the more it spreads down and could affect the whole hip joint, and these could be very difficult to even have a surgical intervention. And so it's also stated that having a bone in one joint could be more likely impacted on the other joint. So if you have one joint being impacted, when you keep accommodating or compromising by accommodating the pain, it could affect your other joint as your hip, your next or your other hip joint. And so these your presentation of this condition could influence the level of treatment for this condition. So if it's mild, we could do conservative treatment such as physiotherapy, such as medication. But if it's very severe, the only option will be surgery. And then after surgery, you return to physiotherapy to return to function. Okay, so your likelihood of also having this condition is due to other underlying conditions which we talked about earlier on. We have diabetes, we have sickle cell anemia, and then to mention but a few, mentioned them in the earlier time of this presentation. Okay, so without much ado, we'll look at some of the pictures and then we'll come to an end for today's presentation. Then we look at our next topic. Okay, so some pictures to show us. Okay, so so this is what we're talking about. So this is a hip joint. Everyone has a hip. Every human being has a hip. Yes, so you can see the hip joint. So this is the normal hip joint, the one on your left, and then on your right, yes, on your right is the necrosis hip joint. So there's a blackish region. It's where you have necrosis. So you can see this hip joint is very, very nourished. You can see the red structure there. These are all blood vessels. These are capillaries, and these are arteries. So I mentioned earlier on, these are arteries. These are not veins. These are arteries where the blood flows into the structures. So these are arteries. So this is the hip joint. This is a hip bone. This is called the head of the femur. The head of femur. And this is the pelvic bone. So around this place is where for women the baby sits. Okay, so this is the necrosis. This process is called the necrosis, where we have the hip joints being reduced. So the head of the femur, the head of the thigh bone reduces in size. So this is an X-ray of the hip region. So this is called the greater trochanter. This is the hip. You can see it here, and this is the hip joint. This is the head of femur. I'm sure you can see it now. It's labeled here. The head of femur. This is it. The head of femur. And this joint is called the hip joint. It's called the ball and socket joint. And then you could have this. The bone here is called the acetabulum. The joint here, where the head of the femur sits, is called the acetabulum. So you can see the normal hip joint, and you can see this space here. You see this space here is quite good, but if you look at if you compare it to this space here, you can see this space is reduced and it's more shiny as compared to this. So there's a structure we call the cartilage. So there's a cartilage around the side which prevents this bone from coming into contact. But in the case where there is osteonecrosis, we have the reduction in the space around the side, and then the bone pushes in, and the bone to bone interaction causes pain and could cause increase in wearing away. So we can see written here, deformed head of femur. Okay, so these are the surgical interventions that are taken into consideration. So you could have this bone plating here, so to stabilize the hip joint. Okay, so this is an X-ray of the hip too. You can see the distraction of the hip there. You can see the dislocation of the hip. The hip has been shifted from the joint. So this is a normal hip joint. You can see the normal hip joint. Yes, the normal hip joint here. And this is the dislocated hip here. And as you can see the hip here, this space here is not as this space here. This is fitting exactly in the hip. But this one has come out, this space here, and you can see the bone out of the joint. So the dislocation that we mentioned earlier on is what we are seeing here physically. Okay, So this is also an example of the osteonecrosis. You can see the head of the femur here is intact, but this place there has been a reduction in the head of the femur here, and this is called osteonecrosis or avascular necrosis of the hip. You can see an x-ray here too. So this is a very good explanation to this condition. It's very, very clear here. Yes, I'm sure we can appreciate it the more, and so we can look at it very closely. Yes. Okay, so another picture here. You can see the normal one here, the normal hip there. Yes, and so I'm sure we can appreciate it more. Or better here, this is the normal hip. I want you to get a very good appreciation of this condition. You can see the head of the hip femur here. Yes, I'm sure we are getting it. So this is another picture here. This is a healthy bone on your left, and then the unhealthy bone on your right. You can see yes. Okay, so as we're talking about now, we're talking about the osteonecrosis. So this is the healthy bone. Okay, we can see the healthy bone here. Yes, so this is very, very, we can appreciate it more. You can see this is the healthy bone. You can have very compact bones here. Yes, you can see the normal bone here. But if you look at the avascular necrosis bone, you can see this is very healthy. You can see this. You can see the cartilage here. It's very healthy. It's called the articular cartilage. But if you look at this one, it looks reduced in size. And these are all signs of necrosis of the bone. This is an x-ray of the bone. You can see the joint here shining. The shininess of the bone indicates the fact that this is reduced in terms of this condition called osteonecrosis, and then they could also cause arthritis. Okay, so this is also an indication. So this is a doctor who in Nigeria who talked about the condition osteonecrosis, and as we are talking about this evening, so this is the joint, the hip joint. The redness shows the pain that is being elicited or shown there. So this is also a very good explanation. You can see the bone here has been reduced in size. Yes, this is called osteonecrosis. This is a normal or healthy bone. The healthy bone here, and this is the very necrosed bone. Okay, so these are the levels of the necrosis. The stage, this is the normal healthy bone, the stage 1, the stage 2, and the stage 3. Yes, okay. So these are some of the tests that as physiotherapists we can carry out. So we do palpation to see whether there's pain or there is tenderness around the hip joint. So some of the exercises as physiotherapists teach the patients. So depending on the level of pain and the age of the patients, we engage in specific exercises. So what the exercise they are watching here doesn't mean that if you have pain in your hip you shouldn't do it, but there are specific exercises that you should do when you have this condition. So these are our physical therapy exercises that we do, and so walking also is a very good way of treating this condition. But then we do progressive walking, that is from mild to moderate to intensive walking. So these are all systemic physical examination that as physiotherapists we go through with patients to treat this condition, as and when it's mild or moderate. When it's severe, there is very little to do, but then refer them to the surgeon to carry out a surgical intervention. Then we return back to function, that's or the physiotherapist. So these are the symptoms. So we can see that redness around the side indicating pain at the hip. So as physiotherapists, our main aim is also to ensure that there's return to function, and also there is good joint range of motion, that is around the joint. So when there is pain, we can suggest some crutches to reduce the pain, or we can do splinting around the joint, around the lower limb, to also reduce the pain. So this is an X-ray of the joint. We can see the joints being dislocated. This is the whole joint. So this is intact. You can see this structure is being reduced here. So this can be osteonecrosis of the hip. So it takes a physiotherapist or a medical doctor to see, or the radiographer to see whether there's a dislocation in the joint or not. So they are experts who are able to tell whether there's dislocation or there's an osteonecrosis around the hip joint. So this is a physiotherapist treating a patient. I'm sure she's likely to be a sickle cell patient or a child who has involved in a trauma, who has fallen down, and so we allow the patient to stand on one leg to put more weight on the affected joint. And these are all technical exercises that when you see a physiotherapist will teach you specific ones. So these are all exercises that physiotherapists teach patients who are having this condition called osteonecrosis or avascular necrosis. Okay. Yes. Okay, so I'm sure we have a fair idea of this condition called osteonecrosis. Yes. And we'll be in a very good position to explain to our friends and loved ones this condition called osteonecrosis. Thank you very much for your time. Thank you very much for your very little time that you had, but you still had to join us. Though we're a bit late, I'm sure we learned a lot. And so we'll talk about our next topic. Our next topic is also very interesting, but then we are waiting to have it's next week Sunday, and I'm sure we'll have a very, very wonderful time. It looks like our Sundays are very, 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 very tight, so we're likely to push our discussions to Mondays, and I hope you all agree with me, and so that at least it looks like there are a lot of programs on Sunday, so we don't have enough time. But then the flyers will flow out, and so you can join us in our discussions either on Sunday or Mondays. And so our next topic is being rolled out, and it's called a ganglion cyst. And so the flyers will be rolled out very soon. I'm sure by tomorrow morning or by latest by tomorrow evening. We'll be circulating the flyers into your various social media. And when you see the flyers, please share it to your contact list, and I'm sure that we'll have a wonderful time next week. Thank you very much for your time. May the good Lord be with us all. Have a wonderful evening. Take care. We love you. Have a blessed evening. Bye.